Hi Mum, hi Rocco. Welcome to the nutrition clinic. My name's David, I'm one of the gastroenterologists and I lead the nutrition team. Welcome. And you're here to talk about gastrostomy feeding today.
Yes.
Well, gastrostomy is a tube that we can use to give feed directly into the stomach.
Why do some children need gastrostomies?
I think if eating or drinking is difficult or unsafe, where swallowing might lead to choking or particularly aspiration of food and fluids into the lungs, then we need an alternative way of feeding. Sometimes children can eat and drink but can't eat enough. Very often children will come to needing a gastrostomy having had a nasogastric tube in as a sort of short-term measure to try and supplement nutrition, manage fluids or medication, but when it becomes clear that they actually need a longer-term solution, and an NG tube can be awkward because it comes out the nose and gets pulled out, then we look for a more secure, safe long-term option, and that's where having a gastrostomy can be the next step. It's a procedure that we do under an anaesthetic, so Rocco would be asleep for the procedure. We would place a tube that would go through the tummy wall and also the stomach wall, and then on the inside would have an opening into the stomach to allow feed to be administered. The two main types of tube that we use are this one, which is what we call a low profile device, because it's just got the small button on the outside and it's held in by an inflated balloon. This is a gastrostomy tube retained by a disc, and again sits through the skin and the stomach wall. The differences between the two tubes are obviously there's a longer extension on the outside of this type of tube, and this is held in with a disc rather than a balloon. This type of tube would require an anaesthetic to change it.
And how long does the operation take?
The operation takes around about an hour and a half. I'm just going to hand you over to Catherine Paxton, our nutrition nurse specialist, who'll talk a bit more about looking after the tube.
Thank you very much for your help.
It's been very nice to meet you.
Thank you.
Hi Rocco, hi Mum, I'm Catherine, I'm nutrition nurse specialist. In the hospital we've got teaching guidelines that you'll get in order to learn to use your feeding tube. It'll tell you how to give your feeds, it'll to go through how to care for your tube on a day-to-day basis. And over the few days after you've had your gastrostomy placed and before you go home, the staff on the ward will support you in your learning to use your tube.
Will it be difficult for Rocco to pull out his tube?
So we recommend that the tube's kept underneath clothing, ideally under a popper vest or at least tucked in under clothing so that the children can't get their hands at it to pull it out. It'd be fine for him to touch it though, he's not going to pull it out just by touching it.
Can children take a bath or a shower after the operation? Can it get wet?
Yep, so initially after placement we recommend no baths for the first 2 weeks unless we've got a bath seat. Perfectly fine to have a shower, and we recommend no swimming or hydrotherapy for the first 6 weeks. I'm going to now just get Lindsay, our dietitian, who will come and speak to you about our feeds. It's been lovely to meet you, Rocco. It's been lovely to meet you, Mum.
Thank you.
Hi Rocco, hello there. My name's Lindsay Rosie. I am one of the dietitians from the community enteral nutrition team. So I've come today to talk a little bit about gastrostomy feeding. So we use the gastrostomy to deliver feed into the stomach, and as a dietitian's job is to work out exactly how much calories, protein, fluid that Rocco requires. So what we will do is we will do a full assessment when he comes into hospital. What we would ideally want to do with gastrostomy feeding is try and mimic daily life. So mimic breakfast, lunch and evening meal. So what we can do is we can use a syringe and the extension set, and we can deliver a set amount of feed via the syringe, and that's called gravity bolus feeding. So basically you would just top up however much feed is required, and then you would hold the syringe like this, moving it up and down to adjust the rate in which the feed is delivered. So the other option is to use what's called a feeding pump to deliver more slower continuous feeds, and sometimes we do that overnight.
I'm really, really nervous about Rocco getting his gastrostomy tube and the feeding. How will I know that Rocco's getting enough calories? What if I overfeed him? What if I don't feed him enough?
So what we will do is we'll ensure that there's a good support network for you in the community. So we have a community nutrition team who would assess Rocco on a weekly, monthly basis just until you find your feet and to make sure you're confident with that. And we'll hope to see you after the surgery, Rocco. Excellent. Thank you so much for coming back to see us. Lovely to see you, Rocco. How have you been? How's things going with the new gastrostomy?
Absolutely fantastic.
Great.
I was so nervous at the beginning and at the start of it, but now I feel really confident with all these feeds, medications, and the gastrostomy and the feeding is going really, really well.
I think it can feel quite daunting. You know, it's something completely new. He's never had that type of feeding before, and going for surgery is obviously very daunting as well.
Yeah.
Do you feel happy with it? You feel it was a good decision?
Absolutely. I mean, even because Rocco's doing some oral eating, but the
Fantastic.
pressure is completely off now because I'm not having to sort of make sure that you're getting enough foods, the calories are there. I know that Rocco can enjoy oral eating, and then he can just have the top up with the feeds. And we did a lot of the training with the gastrostomy just after surgery, a day or two later, and I got shown how to clean the gastrostomy peg, how to feed Rocco with using the syringe as well as the pump. So we're using both.
How are you finding the pump? Have you?
The pump's a lot easier because you're not having to stand there with the syringe.
Excellent. Good.
The school are finding the pump using it easier, using the pump
they're
at
using the
school.
pump at
They're
school.
using the
Oh,
pump
great.
at school, just because there's other children in the classroom and things like that, so they don't want to knock the gravity bolus over. So the pump's a lot safer. And Rocco hasn't been bothered by it at all. He's not grabbing at it. They're sort of, it's there, they notice it's there for a couple of days and then forget that it's there. Yes.
Well, thank you so much for coming along today and letting me know how well things are going. I'm so pleased that it's been a good decision for you.